It's Libby, and I'm going to be talking about improving public health today. By 1900, British towns generally had good systems in place to deal with sewage and to provide clean water to their population. It was largely government intervention that led to these changes. The 1848 Public Health Act was set up a central board of health to improve public health. Towns were asked to set up their own local board of health. Town councils were given the power to spend money on improving street cleanliness. The result of the act was mixed because councils had their own autonomy. Some cleaned their streets, but some didn't. In 1854, the Central Board of Health was shut down, as it was seen as a violation of the government's laissez-faire approach, or laid-back approach. In 1858, London was struck by the Great Stink. The River Thames was so full of sewage and the weather was so hot that London smelt very bad. Parliament, which is located right on the Thames, noticed the smell. This prompted them to improve London's hygiene and sewage systems. Politicians funded an engineer called Joseph Bazalgette to build a new sewer system for London. Over 1,300 miles of sewers were built to take sewage out of central London. Bazalgette completed this within a year, and these are still used today. In 1867, more working-class men won the right to vote. This shift in the voting population helped to improve living conditions across the UK. In 1848, the 1848 Act was voluntary, but the 1875 Act was mandatory. It forced local authorities to provide clean water, provide proper sewage systems, collect rubbish on the street, and appoint a medical officer of health. So let's just think about what we've just heard. So we know that politicians funded an engineer called Joseph Bazalgette to build a new sewer system for London. We know that over 1,300 miles of sewers were built to take sewage out of central London, and that the sewers were completed within a year, and these are still used today. So what forced the government to intervene to improve public health? Living conditions in British towns only really changed because of mandatory government legislation laws. These laws seem to have been enforced for a few reasons. Firstly, political changes. The 1867 Reform Act gave more working class men the vote. This meant that politically to stay in power, improving living conditions for this group was more important. The Chadwick Report of 1842 could have had an effect in increasing awareness, but most of the change came a lot later from 1842. The second is chance. The Great Stink of 1858 was only really created by unusually hot weather. The smell from the Thames reached Parliament, and it took this to lead Bazalgette's reforms of the London sewage system. The third reason is scientific advances. Pasteur's germ theory and advances in medical surgery showed that disease and illness were more preventable than they had previously been perceived. Previously, supernatural factors had been blamed. Statistics collected around deaths and death rates also showed the differences in living conditions, and this may have shamed the government into action. And the final reason is individuals. These individuals all contributed to change. Pasteur, with his discovery of germs and microbes as a cause of disease, Edwin Chadwick's report and recommendations, and Dr. Snow's finding around cholera. So let's just think about those three individuals. We know that they were Louis Pasteur, who discovered germ theory, Edwin Chadwick for the report on living conditions, and John Snow for his cholera investigations. So when was the Central Board of Health shut down? This was in 1854. So let's just look back on these changes that were happening in London. We know that in 1867, this meant that politically, in order to stay in power, it was important to improve the living conditions for the working class. This was because they now had the right to vote. The Chadwick Report of 1842 could have had an effect on increasing awareness, but most of this change came a lot later than 1842. And finally, the 1867 Reform Act gave more working class men the vote. By 1900, we know that British towns generally had good systems in place to deal with sewage and to provide clean water to their population. It was largely government intervention that led to these changes. So let's just think again about what the Second Reform Act of 1867 did. We know that it gave the vote to more working class men, which meant that the government had to pay more attention to their demands and therefore improve the living conditions of these people. So what forced the government to intervene in public health? So first of all, we know that there were technological advances, or scientific advances, political changes, chance, and individuals. The Great Stink of 1858 was only really created by unusually hot weather. The smell from the River Thames reached Parliament, and it took this to lead to Basil Gett's reforms of the London sewage system. Okay, so that's everything I'm going to be talking about now for improving public health. Thank you.